very good morning to all the pretty ladies decked up in pink. Wish you all happy International Women's Day. I'm Dr.Anuradha Nair, already told by the speaker before me. I'm a dermatologist practicing in Bhanuri area. The topic that we'll be discussing today is tips and tricks for healthy glowing skin. As we know, for women, having a healthy glowing skin is very, very important aspect of her life. So today I'll be talking regarding the basic skin structure, what all factors decide that will lead to healthy skin, and the general common skin problems that usually the females in this age group, the young age, come across. So let's get started. So what do you see? A beautiful female with clean, glowing skin. So when I say healthy skin, what are the features that decide that the skin is healthy and glowing? So we'll be discussing the 4 important parameters that decide whether the skin is healthy or unhealthy. First is tone. So what you understand by tone is basically the skin color. An even skin tone is a sign of beautiful skin. It can be of any shade, it can be dark skin, it can be pale skin, it can be white skin, but evenness is something that gives beauty to the skin. When we are young, the skin is able to maintain uniform pigmentation, but as we age, the pigment producing cells, that is the melanocytes, they produce more amount of melanin. That can be result of aging, that can be result of excessive sun exposure, that can be because of smoking, some toxins, the free radical damage, which leads to uneven skin tone or blotchy skin. Next is texture. So what do you understand by texture? Can someone tell me? Texture is when you touch your skin, how do you feel it? Whether it is smooth, whether it is rough. Okay? So again, when we are young, the texture is good because of the skin lipids which are produced by the sebocytes or the oil-producing glands, and because of the firmness or because of the proteins which are produced like elastin and collagen, that gives the texture, smooth texture to the skin. But as we age, again, the texture becomes rough. We'll just see the difference between rough and smooth skin. So can you make out the slide? On the left, you can see that there is minimal pores. It is smooth, glistening, no scars. Whereas on the right side, you can see a lot of skin pores, some scars, some bumps, basically a little bit of pimples, blackheads, which we can see on the right side. So what we are basically aiming for is smooth skin without large pores, without any acne scars, that makes you look beautiful. Now the other parameter is hydration. Hydration is the moisture content of the skin. A well-hydrated skin always looks supple, smooth, and glowing. In contrast to the dry skin, which is flaky, rough to touch, and which is more prone to aging. So for a good skin, we should always keep our body hydrated. At the same time, keep the skin hydrated by using moisturizer at regular intervals. 4th parameter is firmness. Firmness means the tightness of the skin. So how does the tight skin looks and how does the saggy skin looks? Tight skin looks more younger, more glowing, and gives more youthful appearance. So this firmness is basically because of the skin proteins. The 2 main important skin proteins, as you all might be already knowing, is collagen and elastin. These 2 are produced by cells called as fibroblasts in the skin, which give you firmness. As we age, the production of skin proteins by the fibroblast reduces. That leads to loosening of the skin, that leads to fine lines, wrinkles, and folds in the skin. So this damage can again be because of age, because of toxins, free radicals, smoking, alcohol, irregular lifestyle or unhealthy lifestyle. So we have to avoid all this so that the firmness remains for a longer time. Now, in general, we'll just see the basic structure of the skin. It's just a small slide to make you understand what all different layers are there and what role do they play in the skin. As you can see, the upper layer, which is called as the epidermis, followed by dermis, subcutaneous tissue, and the fourth layer is muscles. Now, the epidermis or the superficial layer is like a skin barrier. So when we say barrier, what does the barrier do? It gives us protection. Protection against what all things? Protection against external trauma by ultraviolet radiation, external mechanical trauma, protection from the different microorganisms. So it protects the underlying structures from all these external stimuli. Below epidermis, the layer is dermis, that basically consists of the skin matrix and the cells that produce skin proteins, that is fibroblast, collagen, elastin, glycosaminoglycans, which forms like a scaffold for the skin, gives support to the superficial structure as well as to the hypodermis. Below dermis, you can see there is adipose tissue or the subcutaneous layer that basically is responsible for fat pads. We are having different fat pads all over the face, on the body, that are basically for cushioning effect. At the same time, they even give contouring to the face. Okay? Facial muscles. So facial muscles, you can see these are the different types of facial muscles. These are quite different from the muscles found elsewhere on the body. Most of them are very fine. Their action is related to each other and they are inserted into the facial skin rather than being inserted into the bone. Okay? They are responsible for the facial expressions. When we are young, the tone of the facial muscles is good. That gives us a good tight appearance of the face. As we age, the tone of the facial muscles becomes less and the sagging happens because of decrease in the tone of the facial muscles. So in general, these are the functions you already know, which I've discussed. In addition to this, the role of skin is secretion of sweat, oil glands, vitamin D production, and temperature control. Types of skin. So depending upon the oil production by the skin is broadly classified basically into 4 types. I've written here 5, but mainly there are 4 types. Normal skin, dry skin, oily skin, and combination skin. So what do we understand by each type? So when we see the normal skin, it is neither oily nor dry. It is blemish free. It has a smooth surface and not sensitive. Next one is the combination skin. As the name suggests, certain areas are dry, certain areas are oily. This one is difficult to manage because the products need to be used accordingly. At times the skin is dry, we have to use products for dry skin. When the skin becomes oily, we have to use products for oily skin. This type of skin has some enlarged pores and gets irritated a little easily. This is followed by oily skin. As the name suggests, skin is oily, having large pores, a lot of acne, prone to redness, followed by dry skin. Dry skin, flaky, dry skin surface, no pores, fine lines start appearing very fast in dry skin. And it gets irritated easily because the skin barrier is affected. Sensitive skin is not a skin type, but then that has been classified for the purpose of management. As the name itself suggests, this is a skin that itches, stinges, burns very easily. It's very prone to any kind of allergies and has to be managed differently. Now let's go to certain common skin problems that we come across during young age. As I can see, there are many young ladies out here, most of them students. I thought that I should talk about this in detail, like what all things they can take care of at home from their side to prevent acne. So acne vulgaris, or in layman's term, pimple. Uh, I was talking about acne vulgaris, or what we call in layman's term as pimples. So, pimples basically are of two types broadly: physiological acne and pathological acne. By physiological acne, we mean something that is common for people under 25 years of age because of the effect of hormones that are increased during puberty, like growth hormones and others. There is increased oil production leading to acne. So at least 85% of population is going to have pimples by the age of 25 years. However, anything that comes after 25 years is called as pathological acne. That means there is some underlying cause leading to acne. So in general, the acne can be either mild, moderate, severe, depending upon the type of skin lesions. So we'll see what are the other causes of acne. They are mainly hormonal, the most common being polycystic ovarian syndrome, others being Cushing's, CH, androgen secreting tumors. Certain drugs can lead to acne, the most common in India being steroids, which is used even as over the counter in many areas. Then pregnancy related premenstrual flare of acne. This is very commonly seen in females. Other is postmenopausal. Now let's see the different type of lesions which are present in acne. So you can see this is all the different types of lesions. You can have blackheads, you can have whiteheads, you can have red bumps, you can have pus-filled lesions, you can have bigger cysts and nodules. Now what is the cause? We've already discussed. Now this is something which most of the people want to know or want to ask me. Does diet have any role in acne? There are certain foods that aggravate acne and others which help in reducing acne. So as this is something which is commonly asked, I thought I'll make a slide of it. So what all things that you should avoid is on the left: alcohol, soybean products, dairy products, sweets and refined food, foods with additives, colors and trans fats, chocolates. I think many people love chocolate out here. So that again is one of the reasons. And some people do get acne following certain foods, mainly seafood or certain kind of fruits, which cause release of histamine in the system, leading to acne. So once you see that certain food items are leading to flare in the existing acne or are causing new acne, we should try and avoid it. Okay? Now foods which are good for acne or can help to reduce acne are on the right side. Probiotic food like buttermilk, kefir, pickles, fermented pickles. Then healthy fats. The fats basically omega-3 fats which are present in fish, certain nuts like walnuts, almonds, pecans. Antioxidant rich fruit. Now, antioxidants is mainly present in fresh fruits, vegetables, salads. You should make a part of it. You should make this a part of your diet on a daily basis. Whole grains, high fiber diet. Not to forget water, at least 10 to 12 glasses of water every day to cleanse all the toxins from your system. Green tea, certain types of tea has been shown to reduce acne. Spearmint tea. So people who are interested, they can try that. Now what are measures that can be taken at home to reduce acne? You should wash your face at least twice a day, depending upon your skin type. So some people have dry skin, still they can have acne. Some people have oily skin, they will obviously get acne. So just because you have acne doesn't mean that you should use a cleanser meant for oily skin. Okay? So you have to use products according to your skin type. Other things, healthy diet and lifestyle. Regular meals, regular sleep, eating on time is very important. Once you get acne, many people are tempted to pick it. So you have to avoid picking. The moment you're picking your acne, you're making it prone to scar. So something which is going to disappear without any telltale sign, you make it more obvious by picking it and fidgeting with on a regular basis. That further leads to acne scars. Other thing, manage stress. Now stress is something which is a very under-talked topic about acne. Stress is one of the reasons for acne. So any kind of stress needs to be managed in the treatment of acne. avoid over-the-counter skincare products. Many people come to me, doctor, I got this on the net, can I use it? Is it effective? Avoid using products from the internet without having proper knowledge of it. Okay? Despite doing all these things, if nothing helps, please meet your doctor. The common product or common things which are usually used by us are topical creams as prescribed. Systemic drugs basically consist of oral antibiotics and oral retinoids. Physical procedures that are done is comedone extraction or blackhead removal. People who are prone to acne should go for regular cleanups, removing blackheads at least once a fortnight, that's once in 15 days or once a month at least. Followed by certain laser treatments which help in acne reduction and chemical peels. The treatment of acne scars. Once the acne has been treated, what remains is acne scars. Many people do have acne scars which can range from mild to severe. Depending upon the severity, for the milder one, we do something called as microdermabrasion or skin polishing. For the severe ones, we go with laser treatment, microneedling radiofrequency, subcision in TCA cross. So this was regarding acne. Let's move on to the other topic, suntan. So now we know that this is summer season and almost all of us roam around. Your campus is quite big, so you all guys are really prone to suntan. We can see the difference between the two halves of this female face. One side, clear complexion, other side, darker skin tone. Okay? So what do you mean by suntan? The darkish discoloration of the skin followed by prolonged sun damage. It can be, again, it is of two types, immediate suntan, delayed suntan. Okay? So we'll see how we manage. Depending upon the skin type that tans, we classify it into 6 types, 1 to 6. 1, 2, 3 are usually on the fairer side. They burn more frequently, tan less easily. Indian skin is 4 and 5, 3 also in the north people who are usually on the fairer side. So Indian skin type is more prone to tan and it rarely burns. Type 6 is usually not seen in our subcontinent, it's African skin. So we usually have 3, 4 and 5 skin type. So let's see in detail the solar spectrum that affects the skin. So broadly, these are the 3 wavelengths that affect the skin, UVC, UVB, UVA. UVC is basically the shortest wavelength that was absorbed by ozone layer earlier. But now with the depletion of ozone layer, even this is coming to the atmosphere leading to skin damage. This is followed by UVB, ultraviolet B light, which is the most important solar spectrum affecting the skin, leading to skin redness, skin burns, and in the long run, cancer, skin cancer with prolonged sun exposure. Longer than this is UVA, that goes deeper into the skin, causes more damage, responsible again for aging and cancer. Now there is a specific spectrum of light that I would really like to discuss is blue light. Blue light is the light that is emitted by the gadgets that we are using, like laptops, computers, mobiles, and we are really not aware that this light can cause suntan, it can cause fast aging, and it is even making you prone to develop all sun damage related changes. Like what we are sitting indoors, we feel हम तो धूप में नहीं हैं, घर के अंदर मोबाइल देख रहे हैं, हमें tanning कैसे होगा? No use of using a sunscreen. But that's not the case. Indoors also you're supposed to wear a sunscreen when you're using all these gadgets. Okay? How to select a sunscreen? Now this is the most important thing in a skincare regime, using a proper sunscreen. Okay? So how will you decide? It should be basically a combination of physical sunscreen and chemical sunscreen. Physical sunscreen is a sunscreen which basically reflects all the light whenever we are applying it on the skin. Chemical sunscreen will reflect some light and let some light fall on the skin. So preferably a combination sunscreen is better for using by Indian skin type. Broad spectrum means it has to cover UVA, UVB, UVC and blue light also. Cosmetically elegant, that means it should not be very greasy. It should be, you should feel good after applying it on the face. Should not be irritant, should not be causing allergy. It should not lead to acne, and most important, it should be pocket friendly, economical, because you have to use it on a daily basis in good amount. Now this is something that we already discussed, type of sunscreen, physical sunscreen and chemical sunscreen. So as we can see, the chemical sunscreen will reflect some light, will let some light inside on the right side. Physical sunscreen, however, will be reflecting all the light that falls on the skin. This is usually used by the cricket players, the football players. You see something white covered all over the face. Have you ever seen that white thing on their face? So that is the physical sunscreen, basically consisting of zinc oxide, titanium oxide. We, however, cannot use it on a daily basis because we have to go and face people. So better to use a combination sunscreen having both physical and chemical properties. Now, the other thing, SPF. SPF stands for sun protection factor. What SPF sunscreen should you use? So in general, as a thumbs rule, you should use a sunscreen with SPF 30 and above. 6, 10, 15, 20 is basically for the people who are having minimal sun exposure. But on an average, for Indian skin, 30 and above is good SPF. How to prevent sun damage? So preventive measures are all these. I'll just run through the slide. Clothing. Now what kind of clothes you should wear? Full sleeved clothes. What should be the fabric of the cloth that you're wearing? Preferably the nylon and polyester clothes give better sun protection as compared to cotton or wool. So it is better to use nylon and polyester for the summer season, followed by sunscreen, which I've already discussed, what SPF you should use. Most important thing is sunscreen has to be reapplied every 3 hours if you're going to be out in the sun. What we do, सुबह एक बार लगाया sunscreen, काम खत्म, पूरे दिन का sun damage से protection मिल गया. But it doesn't happen. You have to reapply sunscreen every 3 hours if you want to really protect the skin against sun damage. Other thing is, apply sunscreen 15 to 20 minutes before sun exposure in good quantity. So what does good quantity means? You have to cover face, neck, hands, whichever the sun exposed areas are there, all of them have to be applied. You have to apply the sunscreen properly. Then is sunglasses. So sunglasses basically having UV ray protection property, they have to be used. Shade, try and seek shade if you're out in the sun. Try to be under the tree or search for shade and avoid peak sun. Preferably timing from 11 to 3 is something that needs, if possible, to be avoided. And yes, sun protection just there for summer season. Even during rainy season when you don't see sun, the sun rays are still damaging your skin. So wear a sunscreen in all the seasons. So this was regarding suntan and sun damage. We'll move to the next topic, which is very common nowadays. Under eye, dark circles. Okay. So what are the causes? Genetics. Yes, it does play an important role. Your parents have it, you have it. Then there is facial bone structure. Some people have deeply situated eye sockets, or the bone structure is such that it looks hollow. Your sockets look hollow. Okay. Then fatigue. Fatigue is a very important reason. Prolonged use of gadgets, again, is one of the reasons. Water retention, aging, certain medications, rubbing your eyes very frequently. Some people have this habit of rubbing eyes very frequently. Lifestyle, using certain cosmetics can also lead to under-eye dark circles. Nutritional deficiencies like anemia are one of the most important reasons in India. So how do you treat? You have to figure out for yourself, if you can, what is it that is causing dark circles. Whether I'm not eating properly, I feel fatigue, whether I'm rubbing my eyes, I'm using gadgets for prolonged time, or whether it is genetic. So if you can figure out, well and good, try and take care of that factor. If not, obviously you have to meet the doctor. Other things that you can do is avoid allergens, reduce the use of gadgets. Instead of using your mobile laptops at a stretch for hours together, take a break in between. Okay? And do some eye exercises if possible. You can Google eye exercises which are there meant for dark circles. Healthy diet obviously plays a big role. There's something called as acanthosis nigricans, you might be knowing. This is thickening of the skin, which is seen in people with insulin resistance. Dark circles at times can be because of acanthosis nigricans of the underlying skin. So in that case, we have to treat the insulin resistance. How to treat? We give basically skin lightening agents. There is a drug called as retinol, which is a vitamin A derivative that is used to treat the underlying wrinkles. We can do chemical peels. We can do fillers for the people who are having deeply set eye sockets. Laser treatment, PRP is basically platelet-rich plasma. And last but not the least, people who don't want to do either of this, they can go for a good concealer. Okay. Now this is the last topic that I'll be discussing today, aging. Aging is something not meant for the young females out here, but then they should have an idea what can be done and what exactly happens when we age and how can we prevent it as much as possible. Obviously, we can't prevent it altogether, but at least even if we can reduce the pace of aging, it makes significant difference in the appearance. So as you can see, the two halves of this lady, on the left side, it is young face. You can see the beautiful contours, the firmness, the smoothness, the even skin tone. And on the right side, you can see what you can see. Can someone tell me what are the changes that have happened in the face? You can see sagging of the skin. You can see that the contour is no more there. Okay, contour of the face is disrupted. Deepening of the skin folds is there. There are a lot of wrinkles, uneven skin tones. So, with aging, there are multiple things which are happening. There is loss of fat volume, bone resorption is there, firmness of the skin is lost, leading to sagging appearance. So, how will you treat it? With the help of products. Okay? So, the products that you can use which prevent aging, we can start anywhere after 25 years of age. So what we basically recommend, the best product for anti-aging is retinol. Retinol is nothing but vitamin A derivative that leads to production of collagen. It also leads to production of new blood vessels. So both these together give a firmer appearance, reduction in wrinkles, and a healthier skin color. So whenever you're choosing an anti-aging product, you have to see for retinol in it. Other products that you have to look for is antioxidants, the most important being vitamin C. Okay? Vitamin C is an antioxidant that takes care of the pigmentation. It also stimulates collagen. So search for vitamin C in the product. Hyaluronic acid. Now hyaluronic acid is basically naturally present in the skin. It is produced by the young skin, but as we age, the production of the hyaluronic acid, basically what it does, it holds water in the skin. So that gives the suppleness to the skin. But as we age, the production of hyaluronic acid is reduced, leading to loosening of the skin or sagging of the skin. So we have to search for hyaluronic acid in the product. Then other antioxidants like vitamin A, E, you can see. Ceramides. Ceramides are nothing but the fats, the type of fats that moisturize the skin. So these are the basic ingredients that you have to search for in the anti-aging products whenever you're buying it. How you treat aging? These are certain things that we do as dermatologists. Botox, you might have heard of Botox, is basically a these are the basic things that you should look for in diet. Foods which are rich in all these things, omega-3, as I already told you, healthy nuts, fish, okay? Protein, good amount of protein, as skin is made up of protein. So you should consume good amount of protein in each and every meal for a healthy glowing skin. Vitamin A, carrots, spinach. Vitamin C rich food, vitamin E, zinc, antioxidants and probiotics, and B complex. So how to build a healthy plate? This is just a general representation. You can obviously change it. So half of the plate they say should be having salads in it. Vegetables and salads should occupy half of the plate. 1/4 should be carbs like whole grains, rice, whatever you're using, and 1/4 should be protein. To conclude, good skin starts from within. Our skin is also called as the mirror of your health. So if you all want healthy, glowing skin, it is just not the external skin routine that matters. Your diet, lifestyle also plays an important role. Thank you. Thank you for your time and patience.
चुरी मेरे दिल में समाते हो, ये तो बताओ कि तुम मेरे कौन हो।
दिल की दिल से लगन की ये बात है, प्यार की राह रस्म की ये बात है। मुझसे न पूछो कि तुम मेरे कौन हो।
नमस्ते बहनों और भाइयों, बड़े ही कम शब्दों में आपको सुनाना चाहता हूँ उस साल का लोकप्रिय गीत ये।
तेरे प्यार में चमको जैसे जुगनू।
face in day-to-day life. So there are a lot of transitions going on in your body from childhood till menopause. So can you guess who is boss of your body? Like who make all these changes? Yes, correct. Hormones plays lot of important role in your body. So each and every phase of your body is governed by hormones. So we should know something about your body now. So I think being student and staff, you can understand this is female reproductive system. You can see uterus, then ovary, fallopian tube, cervix, vagina, and associated like there is close association with urinary system and intestines in female reproductive system. What are the common factors you face in day-to-day life? Main is menstrual problems. So normal menstrual cycle, like your period cycle is of 21 to 35 days. So if that is there, that's fine. But if cycle is shorter than that, like some may get frequent periods, less than 21 days, or sometimes it can be more than 35 days. Sometimes flow problems, like somebody may get heavy flow, especially if you are changing many sanitary napkins daily with cloths. That is issue for somebody. Some other problems, like usually in young girls like you, painful period is big thing. So all these problems are common, and yes, there is solution to every problem. So you should be like, need not bear those problems. You should be consulting gynec or somebody who can help you with all these problems. So mostly all these problems are associated with few hormonal changes in your body. So at your age group, contraception is important. Like prevention, we say prevention is better than cure. So unwanted pregnancy is one of the factor everybody is worried about. So yes, there are a number of preventive measures which are there. So there are few male preventive measures and female preventive measures. So there is basket of contraception. From that you can choose what suits you and your partner. And yes, prevention is better, but unfortunately sometimes pregnancy can happen even after taking contraceptive measure. So that also can be tackled. Rather than being panic, you can consult gynec. There are some solutions for unwanted pregnancy as well. So basically, before starting your sexual life, you should consult gynec so as to know which method you can choose and which is best suited for you. So nowadays PCOD, rather than emerging problem, I can say it is established problem. Almost 20-25% female at your age group suffer from PCOD. PCOD is like hormonal change which occurs due to imbalance of ovarian hormone. Now, what are PCOD? PCOD is usually presented by irregular periods, obesity, then some male hormone factors like activism. So it can be easily tackled with simple lifestyle changes. So in this slide you can see, as Skin Madam has already described, I can put negligence. So this is also one of the symptoms which you can see. It is associated with insulin resistance and PCOD. And yes, we can tackle your lifestyle modification. So you should try to maintain your body mass index. What is body mass index now? So it is your weight in kgs divided by meter square. So normal body mass index is 18 to 24. So you can calculate that and try to be on zone only so as to hormonal milieu balance. Simple lifestyle measures like diet and exercise and stress, reducing stress can help you in that. So lifestyle modification means any form of exercise. Hello. Hello. Hi. Yes. So we were discussing PCOS. So it is common problem nowadays. It affects all stages from teenagers, adolescent, reproductive age group till menopause. It affects everybody. So it can be tackled with simple measures like lifestyle modification with diet and exercise. In diet, simple principle like more of proteins rather than carbs and avoiding junk food can prevent uh, unwanted weight gain and PCOD related problems. And in exercise, any form of exercise, whichever suits you, either 40 minutes walk, yoga, or swimming, cycling, any form of exercise will help in keeping your BMI under control and then obviously problems associated with that. So usually it presents in adolescent age group with problems like obesity, acne, hirsutism, baldness, and if we try to lose weight, we can achieve our targets like reducing acne. There are some medications which also help in reducing PCOD related problems. During reproductive age group, it can affect fertility. Sometimes female may face problem related in conceiving because of PCOD related anovulation. And yes, that also can be tackled with simple measures like weight reduction, lifestyle modification, and there are few drugs which will help in achieving ovulation and ultimately pregnancy. So rather than panicking about PCOS, we should change our lifestyle just to take care of PCOS. So other common problem is white discharge or what you can see PID. So PID or pelvic inflammatory disease, it usually presents like white discharge, itching problem, or painful periods, sometimes painful sexual activities. All these are presentation of PID, and females are more prone to develop PID. Why? Because of genetically more surface area, anatomical position of female reproductive organs in between urinary system and your bowels, make them more prone for infections. And how it can be prevented? By simple measures like keeping your private part hygiene, keeping area dry, and like avoiding um, unprotected sex with multiple partners can prevent from PID. And yes, it can be treated with antibiotics, so don't worry about PID. But yes, it has long-term consequences as well, like infertility. So better to treat it rather than ignoring it for longer time. Other problems which we face in common day-to-day life are infertility. So infertility, there are 40% of the female factor, 40% male factor. So 40% are female factor. In female, there can be anovulation, sometimes tubal blockages can be there, fibroids can be there, and 40% are male factor. In male factor, there can be obstruction of vas deferens, then there can be hormonal changes which lead to azoospermia, that means less count of sperm, and 20% are unexplained factor. Like without any reason, there can be infertility, like difficulty in conceiving. So ideally, if you are planning for pregnancy, within 6 months, usually 64% couple achieve pregnancy. And during the course of 1 year, almost 80% achieve pregnancy. But if you fail to achieve that, even after trying during fertile period for a year or so, you should consult gynac so as to know which factor is bothering in conception. And we can tackle that with different methods. Like for female, we can induce ovulation if it's related with PCOD. If there are tubal blockages, there are some simple procedures which will take care of those blockages, and then we can achieve pregnancy. There are some male factors, like some simple supplements can hasten sperm production, can increase healthy sperm production, and can take care of infertility. Then apart from infertility, some other problems in females' life are heavy flow. That can be because of fibroid uterus, some hormonal changes as well. So fibroid is nothing to be worried about. It is seen almost in 20% of the female as extra growth of uterus, and mostly it is asymptomatic. Only it affects 15 to 20% of the cases where it needs to be treated. It is not cancerous, so don't worry about like if I am having fibroid, should I be worried about cancer and all? No, it's not cancerous growth, and usually we need to worry about it if it affects your routine, like if flow is on heavier side, like if you are bleeding for more than 7 days, flow is more, like you are changing 5 to 6 pads a day with clots, or you need to wake up at night hours as well for like frequent changing pads. That is something we should be worried about. And if it is causing recurrent miscarriage, in that case it should be treated. Otherwise, just fibroid on sonography and you are worried about it, need not be worried about it. It is simple extra growth of tissue, and only if it is bothering we should bother about it. That's all. Then now, not taking much of the time, like evening of your life, menopause. That is also important. Each and every phase of your life is important for us, and we should take care of each and every phase equally. So there is transition in female body from 40 to 47, that is perimenstrual perimenopausal transition. That phase we should handle smoothly. There are a lot of hormonal changes which will give rise to irritability, mood swings. Sometimes female may get excessive crying or irritability can be there, hot flushes can be there. Even though you are eating same thing, sudden weight gain can be there. But need not worry about all these changes. You should accept your life, like phases of your life, and manage it accordingly. So metabolic need at this stage reduces. So need not take those much of calories as you were taking before. You can curtail quantity of carbs in your diet and increase exercises at this stage of your life so as to make it smooth transition. I think I forgot reproductive part of your life. So if you are planning for pregnancy, prenatal counseling is important. What is prenatal counseling? If you are planning for pregnancy, so as to have healthy pregnancy, you and your partner should be aware of few things like fertile period, then am I capable of taking this pregnancy? Is my body really prepared to handle the pregnancy challenges? And all these things. You should visit gynec once. And yes, what we see during that visit, usually we check all hormones like is your cycle regular, then are there any challenges like any medical history, thyroid related history, what about your sugar control, and are vitamin levels under control before planning for pregnancy. And yes, folic acid supplement is one of the important thing which can prevent neural tube defect in consequent pregnancy. With simple tablet you can prevent that, and basically you should take folic acid 3 months prior to planning for pregnancy. And even when you are pregnant, then routine antenatal visits are important. Why? Because we can catch some things if going wrong early and can intervene them early if we go for routine follow-ups. So there are 4 or 5 antenatal sonographies which are important when you are pregnant. First and most important is dating scan. During first 3 months we should do that. Why early sonography? Sonography has no harm. That is common myth I can hear, that radiation exposure will be there. No, it is safe method. The way we are speaking now, sound waves, it is made up of sound waves. So don't hesitate for going for sonography. And first sonography is important because it can give us idea about tubal pregnancy and other pregnancy complications. Then as per your pregnancy advances, your gynec can tell you which blood test can you should do, and sonography, sequential sonographies, how you can take care of your baby and yourself during pregnancy. All those guidelines you can get when you consult a gynec. So other important thing is cancer screening. So breast cancer is first most common cause of cancer in India, female cancer. So it can be screened easily with manual examination. Simple manual examination from day 6 to 10 of your cycle. Like after your periods, you can easily check your breast for any lump palpable, any abnormal discharge through nipple. And yes, you can consult if suspicion mass you feel. Then second most preventable cancer is cervical cancer, which can be prevented by simple test called as pap smear. It is just we take fluid from your cervix and send it for cytological examination, and it has detection rate of almost 80%. So ideally, before starting sexual life after the age of 21, you should go ahead with pap smear yearly, and that is like preventive measure we can take against cervical cancer. And yes, that's all. I feel I don't want to bore you much. So these are simple things, and basically you should take all phases of your life with same zeal and zest, rather than like taking too much of stress about career and all. That will go hand in hand with your health. If your body is healthy, obviously you are going to be perfect woman, and don't run behind perfection. You should be yourself only, not like perfect woman. So thank you for giving me opportunity, DY Patil Group. Thank you.